without further ado, we will begin our discussion today, ladies. Hello, hello. Tamara, Tiffany, are you with us as well? Hello, everyone.
Yeah, yes, I am. Hi, everybody.
Hey.
Um, I am I am going to, we know how unpredictable things can be.
Yes.
And so I'm just going to reveal to everyone. I don't know, am I introing myself? I'm sorry, there's a lot going on
Oh,
right
I
now.
mean, you might as well. You have the floor, girl. You good.
I just wanted to give everyone a little background on what's going on right now. I am um, fine, I'm okay, but I'm at the hospital um, because I'm also pregnant. So yes, that's also going on. Everything's okay. I have a problem with my IV. I have home health at home. I have an IV that I get meds from. It was not working correctly. So we got here this morning and we've been here all day. And they actually just came in literally 5 minutes ago and said, we're going to fix what you need. And we've been waiting all day for that. We've had doctors, nurses advocating on our behalf for that result. And so at the very moment I was ready to start, that's what's happening. They know what I'm doing. So they are like, we totally want you to continue if you like. But I wanted to give you that background. That's why I'll actually turn on my camera for a moment to wave at you. Hi, everybody. And those who know me that are on here right now, they know that I would do this. I would still roll with the punches. I would still show up because that's what I've been doing since 12 years old with endometriosis. So my camera may not be on as I planned. I'm not wearing my yellow, my makeup's not done. I'm not in my cute background at home, but I'm here and I'm so happy to be here. It has been a powerful conference so far. So hi everyone, and also bye everyone.
Tamara, thank you so much. Let me know, message me if you are not able to answer anything. We're definitely going to let you relax. I know that you said you want to participate, so I'm not going to kick you off because you said you want to be here. So, I would try to kick you off, but I know you're going to be mad at me. So I would say, but I do want you to make sure you take your priority first. And I think this is so crazy that we're talking about health equity and you're in the hospital right now. That
Yes.
completely crazy, but at the same time, it's very surreal and it's a real thing and this is real life. So I want to say thank you so much. I know everybody is also saying thank you for even still taking the time out to be present and to talk to us today. So thank you for that.
Absolutely.
Okay, so since she already introduced herself, we're going to go around the room and we're going to introduce ourselves. So we can start with anybody else who would like to go. Ooh, that made me tear up a little bit.
I guess I'll go. um, my name is Tiffany Latosky. I do a lot of different advocacy work. I work with the Worldwide EndoMarch Foundation with the headquarters. I also work for an endometriosis specialist in New York City, and I do a lot of advocacy work on my own as well. And thank you so much for having me here. This whole weekend, everything you have has been absolutely incredible. I can't even, I'm like blown away by what you guys have put together. And I'm so honored to be a part of all of this. So congratulations, you guys. And thank you for everything that you've been doing for our community.
Thank you. Next. Shani.
Hey, how are you?
You tried to wait. You knew I wasn't going to have you.
No, not a problem at all. I'm Chantel Thomas. I go by Shani. I am the CEO and founder of the Pretty Periods. It's a sexual reproductive health brand rooted in advocacy for Black women, inclusive of all Black women. Our goal is to basically, dismantle oppressive healthcare systems and make a pathway to access to resources, education, awareness, and care in disenfranchised and marginalized communities for Black women. Our focus is sexual reproductive health with an emphasis on endometriosis, of course, as I'm waiting back news. You know, I had surgery last Thursday, so I don't know if I'm stage 4. I was told it wasn't much endo, so I was stage 4 because I'm claiming now that it wasn't stage 4. So yeah, I'm an endometriosis warrior. I'm a boy mom. I'm a member of Alpha Kappa Alpha sorority and grassroots gang. Like, I love girl gangs. I love grassroots activity, and I am all around like here for it, whatever it may be.
You know, I was about to be extra, but I had to calm myself down. Julia.
Sure. Hi. Thanks for having me today. So my name is Julia. I'm originally from Barbados. I co-founded the Barbados Association of Endometriosis and PCOS in 2016. And that organization seeks to provide support to persons in Barbados who have been diagnosed with endometriosis, PCOS, uterine fibroids, adenomyosis, and bring awareness to these conditions and their direct impact on the individuals and the extended impact on society. And we work with a lot of our stakeholders and beneficiaries to improve the quality of life of persons in our community diagnosed with these conditions. Professionally, I am a public health practitioner, and so everything just fell together when I got my diagnosis with endometriosis, co-founding BAEP, and then just all of the work that has ensued after that. So I'm just really happy to be here. Yeah, thank you.
You're welcome, Julia. And Dr., I want to say your name correctly. Please don't cuss me out. Dr. Ramatu?
Ramatu.
I try to be fancy. Ramatu.
My name is Dr. Ramatu Kasimu. By day, I am a middle school science teacher, and by every other time, I am a public health consultant and academic writing coach. That is what I do through Dr. K's Health Minute, where I provide easily digestible and accessible health information in 60 seconds or less, or I try to most of the time. But it intends to, build health equity in our communities. So education free of jargon and like free of confusion, so that people are empowered to take ownership of their health and to like fight for their health, which is, one of the testaments of having endometriosis. You gotta have that ability, you gotta have that knowledge, and if I can help others get to that point faster, as opposed to like how I did, which was kind of trial and error of like being like, no, you're gonna listen to me. That is my jam.
Thank you. Thank you so much for all of you introducing yourselves. I'm so excited for this panel discussion because honestly, you all are so equipped with all of the statistics, all of the information, and your own experiences and what you see in the community. So really quickly for you, can you all define what you believe to be as health equity? I know we have so many discussions about it, but let's be clear. What is health equity to you?
I guess I can go. For me, health equity is a situation where everyone has the opportunity to attain their full health potential and is not disadvantaged from achieving this potential because of socioeconomic status or any other externally determined circumstances.
Okay. For me, it's intentionality between culturally relevant ways and means in which people are able to access resources that are of need to them, right? So one community may need, like, I look at things in buckets. So while your community may need like 5 buckets to thrive, my community may need 12, and it's disseminated in a way where I can get access to it. It's engaging. It's just not like this one-shot deal and then done. I'm going to hand out this bag of rice and make it work. It's continuously making sure that you have what you need, that it's working. It's a system that's built on movement and fluidity. So if it's not working today, it's easily to be revamped. And so that people can continue to gain these, means to a healthier outcome.
I would definitely piggyback off of what Channy and Julia said, in that, to me, health equity is access without barriers, regardless of circumstance and regardless of situation. It's healthcare that is designed and tailored to not be a one-size-fits-all approach. That's what health equity is to me.
And I guess there's not much left to say. Everybody pretty much covered everything, but to piggyback on what everybody said, to me, health equity is just being sure that regardless of where you live, what type of economic situation you're in, demographics, things like that, you still have the access to the healthcare that you need. And I really loved what Channy said too about, it not being a one size fits all. And I guess everybody kind of said everything already. So there's not much left for me to say.
Well, I would add that I think it has a lot to do with awareness and education as well, because sometimes you don't know what you need because you've just never been exposed to that information. So I think for me, health equity, having the root of my career being education, I think awareness and education is very important as well.
Thank you so much. I'm sorry. Y'all wouldn't believe I just got a phone call. It's crazy. Anyway, health equity. So we kind of got that out the way. It sounds like everything is similar but different at the same time. And we see it so clear. We see it clearly how simple it sounds. But what do you think is the cause of us even having to have this discussion about health equity and why it's important?
I think it's very clear. Systemic racism and patriarchy. I'm just going to shoot straight from, from what I believe, what I know to be true, what I know to be true. I can't speak for anyone else. I can only speak from historical aspects of what has kept my people in positions intentionally for them not to thrive, right? So it's the reason why we have like food deserts. It's the reason why medical mistrust and distrust still occur today. It's the reason why our panelist Tamara was in the hospital since this morning, a pregnant Black woman, when maternal mortality rates are through the roof, and she's just getting seen at 5:30. We know what it is. It's the obvious, even though they want to say that like, oh no, like, that it's not that. We actually know what it is.
Yeah, I have to agree with that 100% with what she just said. And also, it was pretty clear the way that she stated it, but it's aside from the systemic racism and, that whole situation, that is why we're pretty much having this conversation right now. I think even not just race, a part of it, but also socioeconomic status as well. Like if you don't have the access, like we talked about earlier, if you don't have the access to the proper education or to, the proper physicians that you should be seeing for whatever is going on, if you don't have the health insurance, you get treated a certain way, you may get dismissed. And it's such a big issue, especially in our country, but it goes other countries as well. But unfortunately, in our country, it's horrific. The healthcare system is so broken, and the equity is just the equity that should be there is not.
And I want to piggyback off of what Shani, Tiffany said, and I'm also seeing Natalie is writing about social determinants of health, and not really considering the intersectionality of it all, especially for us as Black women, for many of us, myself included, as Black immigrant women. And then when you, again, consider the socioeconomic status and then perception, when you go into the healthcare system, even before you open your mouth, there's already that barrier that prevents, persons from, trying to engage with you. I think all of that comes into play, and is why we have to have these discussions, even though we know, like in our experiences, this is what it is. because the others that are providing the service might not necessarily have those experiences. There's that divide, which hopefully we can overcome, and hopefully this conversation can be part of that.
And I also think, to your point, that like the providers on the other end and people who don't know, to some extent, I think they do know. And so I think, it's when you call them out, is that accountability. It's the air of like, they get to get away with it so much, right? And so that's part of, their existence. So when you call them out on it, it's like, huh? Oh, wow, I didn't know. And I feel like also I'm tired of educating you. I don't feel like I was put here. So now I got to advocate for myself, and I got to educate you in the same moment. Like, how many capes do I have to wear? How much do I have to put on my shoulders here? Like, you knew. Now, granted, in medical school, they may not train you and, bedside manner, things like that, but some stuff you just innately know. And I think, is the intentional bias, if you will, right? Because they think they can get away with it.
Yeah, that, and I'm blanking on her name right now, but the story of the Black doctor that died a couple weeks ago, right, because of COVID, and then like the story was, the doctors was like, we're intimidated by her, and I was like, wait a minute.
Susan Moore. Susan Moore was her name.
Thank you. And it's like how y'all were saying, the intersectionality of like being perceived as a Black woman, and when you go into medical spaces or when you go into any space and automatically assuming like if you're standing up for yourself or you're advocating for yourself, I'm aggressive or I'm intimidating, when it's like, no, you're not listening to me and I'm telling you that this is wrong and this is what I need. And then to have someone who has the experience and is in that field and you are still not listening to her because you have these preconceived notions, and it's all this stuff that has come out about how 30% of doctors think that we don't feel pain the same way that white people do, or that we lie about our pain because it's drug-seeking behavior. That's literally systematic racism, and it's as a public health professional, it's disheartening, and even as like an educator, it's disheartening because it's these things that we know. There are studies. We know this. Like, we can see there. It's not just anecdotal data. Like, we know this, and y'all still doing it. Like at my job, if the principal tells me, hey, you teaching this the wrong way, and they come back and I'm still teaching it the wrong way, some words will be had, right? Some words will be had. So a whole system is treating a group of women, a group of people, period, like trash, and y'all just out here like, well, shorter wait times in the emergency room. But Tamara is obviously an example of not.
Clearly.
I was gonna say, like, it's like we're one of the most gaslit communities that, that just bear the brunt of almost everything, So it's like, so we're gonna act like that, like Henrietta Lacks didn't exist. We're gonna act like Tuskegee Childs didn't exist. We don't want to take, this is, not to anything, but like, it's people are apprehensive about taking the COVID vaccine because of these things that have happened to them, right? You said pain. The first thing, when we show up to ERs, they're going to assume that we're like seeking drugs, you're seeking these narcotics, you're a junkie or something like that. Or this man literally operated on women without anesthetics, right? And you guys go and name him the father of gynecology. Like, are you serious? You've built memorials around the same people that have traumatized our communities, right? So one of the biggest barriers to healthcare and health equity is like, recognizing, honoring that Black people have PTSD caused by your system. And if it wasn't still perpetuated today and continuously happen, then we wouldn't have these issues. So as I was coming out of surgery, like last Thursday, I literally tweeted about this as soon as I came up from, anesthesia, still in the OR. I hear the nurses in the recovery room saying like, they're reading my file, talking about endometriosis. It's a guy, so I'm already heated kind of, because I'm like feeling groggy. I don't know what's going on. But then he says like, my cousin had this, maybe if she, changed her diet or something like that. I hear that this works. I hear that works, yada, yada, yada. So I let them talk. And then I took that moment again in my pain to educate them that, one, you're not going to body shame. You're not going to fat shame. And two, like, this is why people have trauma. I'm going to let you know who I am. You should have did your research, but because you didn't, now you're going to learn today. We're all going to get school. And I'm going to use this moment to educate you when I should not have to. But one, that's a no-no. That's taboo, right? And so you can only speak facts. Your degree is rooted in facts. Your degree, when it comes to me, is not rooted in opinion. So I don't need that right now. So we're not going to speak on my diet. And if you knew, you know that my case has improved so much from what the doctors have said. And I've also changed my diet. So when you're talking about people, you're talking about things, stick to what you know. But it was happening because you were talking around me as if I was not a Black woman sitting in this room. So even in me having access to care, I recognize my privilege because I do have access to care, right? But still, as like Audre Lorde once said, like, even though the shackles are different, I'm not free until my sisters are free. So, you know, I got to do what I got to do until we all get free.
And speaking of, really quickly, so you say you got to do what you got to do. The thing is, when did y'all start this? Like, when did you wake up and say, this ain't it? You know, this is not it for me. I want to go into public health. I want to be a teacher in this type of field. I want to change. I want to be a member of this organization. When did you all say to yourselves that enough was enough?
Oh, I can jump on this. So
You was excited. I seen it.
You know, younger me had ideas of being a pediatrician, and until my OBGYN told me, she was like, oh no, you gotta be able to see children in pain. And I was like, oh, never mind. It's not for me. But my senior year at Baylor, which is also when I got diagnosed with endometriosis. Mind you, this is after like years of being gaslit, of being told, you know, that the pain was normal and that this was fine and whatnot. And y'all, let me tell you, I got diagnosed with endometriosis on like a fluke. Like I had some abdominal pain that had nothing to do with my endometriosis. They thought I had a hernia. And because of this, they like ran all these tests. I got like a gastro thing. And then finally somebody was like, maybe it's endometriosis. And I was like, what's that? So went and looked it up, and then, you know, of course, had the whole, oh my God, I may not be able to have babies. That, you know, that thing, I'm sure you guys know what I'm talking about. But I, you know, then at that point was like, okay, well, I'm gonna switch to, I want to be OBGYN because like that's a natural process. All I got to do is stand back. This is my nativity before I realized there's so many things that could go wrong in labor, where I was just like, all I got to do is stand back and make sure that sucker ain't coming out sideways. So, you know, but my senior year, I had to take a sociology and medicine class, and that's how I got introduced to public health. And in my like grand idea, I was like, okay, we'll be the best doctor. I need to have prevention. Like I wanted to have prevention and diagnostics in my practice. And so I was like, well, I'm gonna go get my MPH. And I don't know what it was, but I like during that process, that's when it clicked for me that like, okay, this is my wheelhouse. This is where I'm meant to be. This is where I'm supposed to be. And so, especially like just seeing how much, even like in the diagnosis of my, and how it's treated, like for my endometriosis. Again, I had been telling doctors this for like, so I started my cycle when I was 11. And I had been, and to be honest, like, I don't know, I think I kind of had a little bit of atypical endometriosis because I didn't start having like super bad cramps until I was like 15. But the heavy bleeding was there before that. And, you know, I would be like telling them, and they're like, oh, we're like, I'm perpetually anemic. Anytime the school has the blood drive or whatnot, and you can never give blood because I'm always anemic. And I'm just like, this isn't normal. And they're like, no, it's fine. It's, you know, it'll be fine. And I'm just like, no, man, this ain't normal. And like, my mom is telling them that it's not normal. And she's like, finally, my mom was like, hey, you know, I got fibroids and stuff. And then they were like, oh, well, why did you say that? Maybe that's what's going on with her. And even then they were like, but we don't want to do no one did a sonogram, no one did nothing. So I was just like, literally, had I not had that abdominal tear, whatever it was they thought it was, I would have never got a diagnosis with endometriosis. And that whole situation where I had the laparoscopy, found out that I had stage 2, the vision, then they put me in Lupron. And, you know, I was in menopause for 6 months. That's 6 months. I know you're shaking your head, but it was a great 6 months. It was a great 6 months. There was no period pain. There was no cramps. I had my surgery in September, had my first cycle the next year in June. And it was a little trickle, y'all. I was concerned. I was like, wait a minute. This is just a little trickle. July came, and I guess my uterus was like, you put me to sleep. I got you. And y'all, so I called the doctor, and at 21, he was like, yeah, if that didn't work, your next option is a hysterectomy at 21. That is what this man, I had never had any kids, hadn't even thought to have any kids at 21. And he said it with a straight face, like real calm. I just hung up the phone in his face, and that was the last time I saw that doctor. So that is where my fire comes from. That is where my fire comes from in health, and that's where my fire comes from in education. Like, I'm always like, my kids know, my students know, like, if ain't nobody else gonna go for you, Dr. K will. They will come for me. Miss so-and-so said so. Oh, okay, give me a second. I'll be right back. But just, I do what I do so that others don't have to go through what I went through, and that they can find their voice sooner than I did.
Thank you, Dr. K. Before anybody else shares, I want us to take a deep breath, because I feel like we all ready to fight. So let's all take a deep breath and just take a moment and relax a little bit, because this is about to be a heavy ride, and we want to make sure that we are not overwhelmed with emotions, but we are overwhelmed with emotions enough for us to motivate ourselves to continue to go, if that makes sense. Y'all all with me? All right, Julia, Shani, Tiffany, and Tamara, y'all are next. Go ahead.
Yeah, sure. So there's some similarities there with Dr. K's story. So I always knew I wanted to get into public health. I grew up with a parent who was working in the health sector in Barbados, and I was always around, medical professionals, allied professionals, and I was just always curious about what they did. So after I got my bachelor's in biology and microbiology, I just knew. I thought I was going to continue along that path with microbiology and communicable disease and communicable disease control. However, after I got married and I had my second ruptured cyst, which I then knew was my second ruptured cyst, and this is after 15 years of every single month dreading my period, I was then told, I think you may have endometriosis. After, looking at my medical history, recognizing, I wasn't getting pregnant and I had these cysts. And I was like, but I've never heard of this condition before. I've been studying, health-related conditions for basically like the whole time I was in studying. And why is this the first time I'm hearing about this? So I got frustrated. And then I got a pamphlet just given to me and said, this is what it is. And the only way to really diagnose it is if you had the surgery. And so I said, okay. And I had a conversation with my mother, and obviously she's an older woman. And so she said, this is the first time I've ever heard of this condition too. And I started to Google, and I again saw the information regarding infertility, recognized it was chronic, and I started to get sad, but then I got more frustrated than I was sad, because why is this condition that we knew from the 1930s that affects 176 million women and girls worldwide, that there are these symptoms that are specifically associated with it that I was experiencing, why throughout all these years had no one ever told me about it? And so I had my surgery and I was diagnosed with severe endometriosis, so stage 4. And I got even more frustrated, especially when the attending told me, if I needed to have children, I should start now. And again, pregnancy is not a cure. And I just started my master's of public health. So obviously that was not, something that was in the works at that point in time. So whilst I was doing my MPH, there was more of a focus on NCDs as opposed to communicable diseases. And I recognized more and more that I wanted to take this information that I was learning and apply it to the situation in Barbados, where there was no publicly available information about endometriosis. There were no resources available. It felt as though I was alone, which, statistically I could not have been, but no one was speaking about it publicly. And so I said at that point in time to the attending, I'm gonna do my dissertation, my thesis on endometriosis in Barbados. And I was told no one cares about that. So who told him to tell me that, because I just got even more emboldened. And I decided, you know what, you might not care, but I care. And I know that there are others that are potentially suffering, even if they're not speaking up. And so whilst my public health journey was going to happen, I think my endometriosis diagnosis obviously forced me onto this path, which I am appreciative of, because I've met a lot of wonderful people on it, but I've also recognized that there's so many gaps, there's so many unmet needs, and it's just making me more and more resolved to make sure that a lot of these needs are addressed for, you know, the communities and the populations that I specifically I'm a part of. So that's it for me.
Julia and Shani shared something earlier and I wanted to say something about, and then Julia, it's just reoccurring where doctors are putting their opinions in so much. Like, this is not an editorial, this is fact-based. Like, this is not where you tell me your opinions, this is where you tell me the facts. And if you can't address me with the facts, then I think you should keep everything else to yourself. I think that is the problem that we're having so much. I want to, continue with the conversation, but I want to make sure that we highlight as much as possible, because the history behind health equity, the history behind all of what we've been talking about this entire conference is just so crazy. And I'm pulling out my notepad because I can't remember all this stuff off the top of my head. Shani, you hit on Henrietta Lacks already, the Tuskegee Syphilis Act, the Guatemala STD study, the Guatemalan STD study. You have the eradication of Black cancer patients, Project 4.1, experimental AIDS vaccinations. The list goes on and on and on. So how do we, as a community of Black women, as a community of women of color, how do we encourage people that look like us to go to the hospital? Like, how do we do that?
One, you have to make sure that they're in a space where they have access to these resources to begin with. And then, people have to be empowered for themselves, right? You can give them the tools so that they can empower themselves. I don't like using language like, I'm going to empower you. No. Get these tools and you can empower yourself. So you educate, you make aware, and then you provide resources that are culturally, again, relevant so that they'll know what to do and how to navigate for themselves once they're on their own. And so for the first few times, it may not be on their own. It may be, taking a community health worker or a navigator or peer with them, right? It's, taking a notepad with them, having these questions already written down so that you know how to engage your healthcare provider. It's not being afraid to, push back, as someone mentioned on an earlier panel. In these spaces, sometimes we feel as if, the doctor is the authoritative person because we may not be as, educated on the system. So we think they know what's best for us. When, and in most cases, you kind of know what's best for you and your body. I'm going to backtrack just a bit, as you mentioned, like what got us into this field. And it was a call to myself. I've been in public health for over 17 years. My day job, DC government, I work in sexual reproductive health, STD, and I've been doing this work for a long time. I did HIV case management for Black women for a long time. And I was, afraid to come out and speak about my endometriosis because Black women, you're only allowed to be two things. That's crazy or angry, right? You're never really allowed to be educated. You're never really allowed to be anything else, because when you do, you step outside of these boxes that they've put you in, and then you become everything under the sun that's negative, right? And so my sister, she's on the call today, post my second laparoscopic surgery, she's like, you got to do something. So we went on, I want to say like Meetup, and we were looking on all these platforms for endometriosis, and I didn't see women that look like me. So I was like, I'm ready to do this call to action. I'm ready. Then I came across Lauren, right? And I literally begged and bugged Lauren all the time, like, you need to do this, you need to do this. This is what you should do. And then she's like, girl, you can work for Endo Black. Just come on, right? But it was because of the things that I've gone through. It was because the community has normalized things that are not normal. So I don't even like the word normal in my vocabulary as much, because what's normal for you may not be normal for me. And again, you can't blame our parents because it's what they had access to and what they were conditioned and resources that were handed down to them. So they were doing the best of what they could do with what they had and what was taught to them. So I don't hold my parents accountable, although my mom like checks shit very early, right? This is not normal. This is, you're gonna go to the doctor for this and get a second opinion. And again, privilege, we had access to resources that allotted me a second opinion. So I was grateful for that. But now it's leveraging resources and what you have. It's people like us who have access to the education, the awareness to go back to communities that may be disenfranchised, marginalized, or may need a little uplift, and giving them what they need. Is, you know, and it's just not tokenism. Don't do it when it's just beneficial for you, right? Don't do this one-shot deal. Don't record it and put it on Instagram and think you did a good deed. It has to be a real system, okay? It has to be continuous and making sure that you see it through from point A through Z, and it has to require revamping, if you will. So it's not afraid, even when it makes you uncomfortable, you have to check shit and be okay with saying that's not cool and calling stuff out when it's not yourself. And I'm comfortable with that now. And so recognizing things to say, hey, no, that's not right. Even I'm always in somebody's business. And so I'm telling you, like, hey, this is what you can do.
You
This
know
is
my
how you
business.
don't do that. But I'll be forever in someone's business when it pertains to health equity and making sure that they get justice, right? Because that's what I think we're all here to do. We're here to make the lessen the load for the person that comes behind us. And like, again, I had my third laparoscopic surgery, and now I'm in the process of building resources so that I can get copay assistance programs, because I heard someone say that like they couldn't afford their copay, so they had to delay their surgery. That just broke my heart. So I want to start a program where I can get some copays going. Fertility, I know, super expensive. My insurance is top tier. They pay for nearly half, and they got other means that can help me out. Someone says they're struggling with that. That's not cool. So it's checking systems, it's checking boxes and filling gaps where you see there are gaps, even if those gaps are not pitfalls that you may necessarily fall in. And so, and culturally competent too. It just can't be done how you wanted to do it. It has to be in the language and lingo, as Dr. Ramasu said, like that is for that person. And just because you want to do something, I realize that these communities, you have to give it to them how they can honor it. And that's okay. And it's not just a one-shot thing. Again, sometimes you may go in and they may push you out and they may say, you don't know what you're talking about, we don't need you. But then if you keep going, it has to be genuine. It can't be very disingenuous. And like you expect them to take it just because you want to give out handouts. Take you your handouts and go home.
If I could just piggyback on what Channing just said, which was amazing, by the way. One of the things that I try to focus on, or that kind of got me involved in all of this as well, is the lack of education that's out there for especially like teens and younger girls. Like, you know, we were all kids at some age watching that period video in school that teaches you, you know, it's some like after school special where it's like this ridiculous video that teaches you about the period, or like in health class or whatever. They don't ever teach you about endometriosis or that, you know, period pain is not normal. The school nurse does not teach you, you know, that if you have a repeat customer, I call it, you know, where they're constantly in the nurse's office, to contact that parent and say, hey, maybe you need to take her to the gynecologist and ask about this endometriosis. So that's actually a program that I was working on prior to COVID. I had started going into schools, getting, you know, the education to the nurses, and even as young as elementary school is really where it needs to start, I think, and all the way through. I think that that's something that, especially in the communities that don't have the resources, that really lack those resources, it's so important. If we could start with the schools, it's a good way. I know it's not in every community, it's not the best way, but it's a start. So that's where I intend to go. That's where I'm trying to go back to. Unfortunately, due to COVID, all of my assemblies, everything got canceled. You know, everything's virtual, but they're not really doing a virtual period talk where they're having, you know, so it's been a little bit difficult since then, but I still have been trying to get the education out. So there's like packets that we're getting sent out with posters and pamphlets, and trying to do one-on-one calls with some of the school nurses just to like properly educate them of symptoms to look for and things like that. I think that the education is, I mean, as we all know, the doctors aren't even educated, right? Like half of these doctors don't even know what they're talking about when it comes to endometriosis. We have to be our own advocates. But if we could get a little more, you know, education out there right from the start, that would, I think, help get the resources to, you know, where they need to be. So I love everything that you said with that. And I 100% agree that that's something that we need to focus on. And just like you said, that, I mean, everyone so far today has said kind of what got them involved in this and realizing that there was a problem and what needs to be done to address it. I mean, we all started probably from somewhere, not really knowing where to start, but over time we've learned, you know, trial and error. And for myself, it was the same. I grew up in a very poor neighborhood. I'm Hispanic. My mom I'm half Hispanic. My mom was white. She's passed now. She was Irish, blonde hair, blue eyes. And my symptoms started at 9. I was like very, very young. I didn't even get my period till 12, but I was like very sick at a very young age. And the very short version, I don't need to go on. I'm sure we all could talk about our endometriosis stories forever, but they told me at 13 that I was Hispanic, so I should go on birth control because I have more of an issue of being likely to become pregnant very young. Like, that was my first trip to the gynecologist, being told like, oh, well, you're Hispanic, stop. I actually asked about endometriosis because it ran in my family. So I knew that at 12 years old, that was a possibility. I was one of the few people that actually, at that young knew about it, because in my family, it's very prominent. All the women in my family have it. So I knew of it and I asked of it, and they said, you are way too young. You can't have that. That's like later in life that you get that. And you need to worry more about getting pregnant. I wasn't sexually active. I was 13, and they immediately put me on birth control. This will fix your period problems. It'll fix everything. Fast forward, I was constantly in the ER, even as a teenager. We all know this, where you're sitting there for 15 hours not being treated and, being listed as a drug seeker. But fast forward to when they finally did diagnose me after my 3rd laparoscopic surgery is when I actually got a true diagnosis, because the first 2 times they just said it was scar tissue. They said, oh, you have endometriosis. You are not going to be able to have kids. So I was first told as a young child that I needed birth control to not get pregnant. And then I was about 19, 20 when I first got diagnosed, they said, oh, now you can't have kids at all. So that was my first clue. The system is broken. There's something very wrong. And I tried. I feel like I've been advocating for my own health since I'm a child myself, and unfortunately my mom also, she died of cancer, endometrial cancer, that they never found. They just brushed her. She did not have good access to healthcare. And unfortunately, she would go to the doctors whenever she could. But like I said, we didn't really have a lot of money, and she couldn't really afford the healthcare that she needed. And they dismissed her constantly every time she was going. And she was in the ER a lot too. Come to find out now, many years later, I've had her reports reviewed. She did have endometriosis, undiagnosed, that actually turned to cancer. And when she died 15 years ago, that was what kind of really set me in motion to try to fix this broken system and do whatever I could to try to, get more active and see what we can do.
That's crazy. I'm so sorry, first of all. And, you talk about advocating for yourself as a child.
Right.
Child,
Right.
First of all, it's already difficult as it is being a woman. Then you are technically a minority according to
Right.
whomever.
Right.
And
Right.
then you're also trying to advocate for yourself as a child. They don't listen to children. They aren't listening to people of color. They don't listen to women. So that's like, what are you supposed to do in that situation? So you telling that story, I hope that motivated people. Someone definitely, Kelly Collins just said, family medical history, and they still ignored you.
Yeah.
You literally told them and asked.
Oh yeah. Yeah.
So
and
clearly
the women in my family that had it were young. They were in their 20s, like early 20s, and they had diagnosed through laparoscopic surgery. And when I used to pass out, we could go on about our symptoms forever, right? We all have it terrible. So it was so bad at such a young age. And they still, even with family history, I was told, you're too young for that. You're being paranoid. You don't need to worry about that. Just go on the birth control pill. I was on Lupron for 3 years straight. They put me on Lupron with no breaks when I was like 18. And yeah, it's just been such a fight. And now thankfully my health, I have other health issues, but my endometriosis is pretty much, I've had 13 surgeries. At this point, I have like nothing left inside me. My kids call me the Tin Man from the Wizard of Oz. They joke around because it's like I have nothing left.
I'm glad that you can find laughter in it, though. It's crazy as it sounds, but you find laughter, and I think that's what keeps us going and keeps us motivated, honestly.
And what keeps me motivated is just knowing that, like, I tell everybody else, when your struggle becomes your strength, like, that's when you found your purpose. And
Yeah.
that's what happened to me. Like I struggled for so many years,
Mhm.
and I still do with different things, but this is my purpose. It's to help other younger girls, especially, is what my focus is mostly, to try to help those younger girls get heard, listened to, educated, you know, so that they don't have to go through what I did.
Mhm.
I think that's why we're all here, right? Like, we don't want anyone, that if we could help one person not go through what we've all been through, that's why we do what we do.
Thank you. Thank you so much, Tiffany. I really, really appreciate that. We have some questions that are rolling in, so keep those questions coming. We're going to get to them as soon as possible. We would love to continue to answer some of your questions. Just, hearing all of you talk about, your experiences, your stories, health disparities, health situations that you've actually dealt with, or stuff that you heard of. It's very overwhelming, but empowering at the same exact time. How do you do it? How do you stay in this? Tiffany, you shared about your motivation, but how do we all continue to stay in, I don't want to say fight mode, but technically, how do we stay in that?
I I want to speak to that. I think it's every time I see the light bulb go off for another woman, when I see the look in her eyes or she pulls me to the side after I've spoken somewhere. I really went, I got, I'll say my diagnosis was a little different because went in surgery for fibroids. And when they opened me up, they found so much scar tissue. Endometriosis had affected so many organs. I hadn't even been diagnosed with it before I went into surgery. I woke up and found out that they had to do emergency surgery and remove my right ovary and fallopian tube and massive fibroids and my appendix and do surgery on my bladder. They had to do all types of stuff at that moment. And when I woke up and found out what happened to me, I think that's where my fire started. And it made me go, this was all lack of awareness. I was 29 years old. I had been suffering since 12, and it was all lack of awareness. So I think the fire keeps burning every time I talk about this somewhere, I mention it. And somebody says, I didn't know what that was. I didn't know what to ask my doctor. I didn't know what I was going through. I just thought I had to deal with it until I heard you say something. Even if it was just all they heard was the term endometriosis, it gave them something to Google after they left that event or that conference or that function or whatever. And that's what keeps me going. Hearing success stories of people saying, I heard your story, or I heard you say, one thing I will say, and it was really important to me to share today, was how you talk about your pain when you're in medical care. If they give you that, one of my best friends, who's also Tamara, she she said, you have to say this. If they ask you what's your pain on a scale of 1 to 10, don't base it on what you are able to tolerate as pain. Think about how you're actually feeling at the moment, because sometimes that works against us. And sometimes that's the only thing I share. I say, if you are curled up in fetal position, don't tell them it's an 8 because you've been in more pain than that before. Tell them it's a 12. I'm in a lot of pain and I need help right now, because that's part of what that tolerance myth can come from. We know what we're used to. So it's just seeing that light bulb go off for people and really seeing them say, I can make better decisions about my health just because I heard you share. And I wasn't afraid to say period or uterus or fallopian tube or ovary, when so many people, feel like it's too taboo to even address their pain because it's going to make too many people uncomfortable. I literally woke up from that surgery, found out what was going on with me, and I said, wow, well, it picked the wrong person, because I'm never going to shut up about this.
Thank you. Anyone else would like to share?
I would say, for me, if it's not me, then who will do it? And so oftentimes I figure a lot of communities wait, and we wait for someone to save us. But and even if I have to die on this hill, I have to save myself, right? And in saving myself, I know that I will do justice for someone who's going to come behind me. And so gratefully, like, I don't have to walk this walk alone. I have Lauren. I have so many Endo sisters who I can just rattle off, right? There's Samantha. They're all my Endo sisters at Endo Black who are in this fight with me. So you guys keep me going. But I know that I have to do it for not just me, because it's nothing really about me. And I'm a very spiritual person. And like, so God didn't give me this just because. No, it's to help someone else who may not have, it's health equity, right? Who may not have the means and access to the resources that I have. So while I have this, let me make the most of this situation, even though it's nothing pretty about it. And that's why I chose the words that I have, because there's nothing pretty about it, right? But I've met beautiful people along the way. And that's something that I often say, but like, if I don't do it, who will? I just can't wait and keep looking for someone to do what needs to be done. Sometimes you gotta lace up those straps and do it yourself. And as Dr. Ramatu said, like, when you see someone else liberated, someone else shackles fall off, someone else free, even if it's just one person, I've done my job. If someone, like Tamara said, knows the word uterus and they can accurately, define what's going on with them, I've done my justice, and I'm okay with that. And so that's what keeps me going, knowing that even if it's just one person, I'm gonna make a difference somehow, somewhere. And someone is, again, waiting on me to make a difference.
I just wanted to share one thing really quickly. I was looking at it was an old speech that Oprah did at the Essence Festival. She quoted Maya Angelou. Maya Angelou once said, "Every time you see me, I come as one, but I stand as 10,000. And a lot of people don't really understand that. But when you see me, you see us. You know what I'm saying? And that's what I get. That's what I get out of all of this whole discussion. I think it's really powerful and really amazing that women are, saying what you're doing is not right. We have to say something. We're going to make a difference and we're going to change. So thank you for answering those questions. We're going to take it over to the Q&A. Natalie said, how do you all handle the anger that comes with diagnosis and living with endo?
I would say for myself, the anger definitely got the best of me for quite a few years. I'm sure we've all been guilty at some point of letting it consume us in some way when you're really living in the moment of it. But like I said earlier, taking your struggle, turning it into your strength, that's pretty much how I deal with the anger. I use that fire, that fuel, I use it to go out there and just try to help other people with it. And that's why I, became an advocate. And I also think it's really important to learn to practice mindfulness. And I know some people think it's cheesy or whatever, but for me, meditation works. And it's not just yoga meditation. I know some people love it, some people hate it. Meditation for me isn't just sitting quietly and what the typical meditation is. Sometimes it's singing in the car. Sometimes it's taking a long hot shower. Sometimes it's taking a bubble bath. Sometimes it's going for a walk outside. When I say meditation, I don't mean the typical where you're sitting there, it's just whatever works for you to make you happy. You have to hang on to those things, as hard as it is, and as angry as it makes you, and how frustrating it is every day. You have to try to find something that makes you happy, or to clear your mind as often as possible, just to let go of some of that anger, because it can consume you. I not only was angry, but the depression from it for years and years. I mean, I don't really talk about it very often because I get really emotional when I do, but I look back on videos from 10 years ago from when my children were small, and I don't even, it's like I'm not even there. It's like I'm just in a zone. It's very heartbreaking and hard to watch those videos of myself with my children when they were small, because I let it consume me. And it was just, when you're just trying to get through the day to survive because you're in so much pain all the time, it could very easily take over your life. So I think it's really hard. I mean, it's really important to try to find some balance.
I will also say this, Black women have the right to be any damn thing they want to be. So if you want to be angry, it's okay to be angry. You should like be able to feel
Yes.
a full range of emotions. And like Solange said it best, I got a right to be mad. So in that moment, if you feel mad, if you feel sad, if you're depressed, a lot of things are connected. Like, you know, like you went in just for a typical surgery and it happened to me. Now my ovary and my fallopian tube is gone. I'm mad as hell, right? And I realized that in some spaces, it's okay to be mad because mad has gotten things done for me. Angry has, you know, flipped over that table, and I've seen results from when I just was being silent and when I cried and I just sat there and asked. So when I asked, I think Tupac said, now I got a kick in your door and now I'm taking it. So DC City Council knew my name, right? And then when they saw me coming, it was like, you got 2 minutes. Who got 2 minutes on the clock? We had to talk today. And it's like, let her say what she got to say, because if she doesn't, she's going to be back. How can we support you? How can we help you? So that anger, not all the time, but it can work in your favor sometimes. Allow yourself to feel range. You know, Black women are diminished to so much that we're not taking it seriously. You don't have depression. Get over it. No, you know, oh, you felt at something, get over it. No. Like a part of me is not working. That's how I felt when I was first diagnosed. Like as a woman, I feel inadequate. I feel less than. Like, what you mean I can't have kids? You know, like that was huge for me. So I had to process, and my sister helped me. She's a licensed clinical social worker and therapist. Let me know that it's okay to feel range and just not be consumed by it. So now it's like I can indulge in things that make me feel better when I do feel that moment. But if it's in a moment and I need to be mad, I'm going to process things and be mad, but I'm not going to just be pissy mad all day, every day, right? And, you know, I have to know there's a time and space for everything. But in that moment, if you need to be mad, you need to be angry, you got to press the envelope a little bit, it's okay. And I think everyone has dropped so many great tips on how to, you know, kind of cope, right? But making sure that you're not just coping, you're processing while you cope. So it's just more than just, you know, taking a bath, going hiking and journaling. You really have to feel that range of emotions and then actually walk through and get over it.
And I just want to
get through it, should I say.
I want to piggyback off of everything Shani just said. So yes, I got mad. I definitely felt rage. And to some extent, I still get mad, but I repurpose it. I process it. I think about why. What specifically is making me mad? You know, being diagnosed with endometriosis is frustrating, but what at that point in time is what is frustrating me the most. And from that, and I say we because BAPE is the organization, we've been able to take that anger as an organization and use it to develop programs, to develop initiatives, to develop culturally competent resources, because again, I'm from Barbados, we are 92.4% Black. And so with that being said, we have to make sure that we can't always be using content from the US or the UK, whereas, you know, the information is factual theoretically. It might not necessarily resonate with our population. And so we get angry, but then we use it and we apply it so that it makes things better for those who are coming after us. So we were able to develop our school tour. So we've gone into the schools, we were able to develop a resource book outlining, you know, endometriosis and other conditions and how we felt and how others would feel, and have that disseminated into schools. We work with the doctors, we work with the medical fraternity, because we need them to know how we feel. And we also want them to be more, again, sensitive to the situation. And we also work in the community because community support is so critical. Barbados is small, we have a population of 250,000. And so everything is just so concentrated, and it's really important for persons to know that whilst we're angry for a reason, and we want you to not gaslight us, but to understand and to support us.
I'm not gonna lie, I waffle a lot. Like some days, I'll be like, oh, it's fine. Like the dog in the house where it's on fire, it's fine, but it's not fine at all. And you know, I had my first surgery when I was 20, and then I didn't have the next surgery. I had polyps, had to get uterine polyps removed. And then I had another surgery. She had done the sonogram afterwards, and she was like, oh, you have a fibroid. And I was like, why are you bringing your raggedy ass to the party? Like, I had the one thing, like, why? And for 2 years, y'all, it didn't grow. And then for some reason, because, and you guys already had said it in the chat or whatever, that diet isn't necessarily a solution. as far as like losing the weight, like changing the way you eat, yes, but like losing the weight. She was waiting for, she wanted me to lose some weight before we could do the surgery. And so in the process of losing that, the fibroid grew, like doubled in size. And so got that removed. And she was like, hey, can I see your medical records from when you were diagnosed with endometriosis? Because there's no endometriosis now. And I was like, the devil's a lie. The devil's a lie, because what am I feeling? Because what is this? What am I feeling? And so I was supposed to have my like 6 months checkup, post checkup, and then, you know, COVID happened or whatnot. And I was like, I knew like the, you know, my periods had started coming back and whatnot, and it was hurting in a different place. And so I was like, there's something else. Sure enough, go back and I had a new fibroid. Now this time was like in my uterus, like in the cavity. Before it was like in the muscle. And so I'm not gonna lie, like I cried, like in the car, just like bawled, because I was like, yo, like to get the other fibroid removed because it was in the muscle, I had to have like basically a C-section. And y'all, I went 6 weeks. I thought I was full healed. My incision opened. It was a whole thing. Like it took 13 or 18 weeks for me to be fully healed. So I was just like, I went through all this only for, you know, this to happen. And then like, I'm not gonna lie, y'all. So I had my follow-up sonogram in August. I was supposed to go back in October, and it was like right before my birthday. And I was like, I don't want any bad news. So I didn't go back until January. Well, Chad, that's what I call my fibroid, Chad, in August was the size of a mini gumball. Chad is now the size of a cutie and is expanding the top part of my uterus and is causing me to show as if I was pregnant. So now obviously more slaps in the face, more slaps. So yes, Chad, right? Chad just sound like he just, you know, evil. So, and I apologize if any of y'all got any relatives named Chad. It made me, I have to name things. Like I named my imposter syndrome Ethel. And, you know, again, if y'all got any relatives named Ethel, but Ethel just sounded like a hating bitch. So I just, you know, that's what I named her. But I have to have like the humor in it, because literally, y'all, there are days where I'm just like what ladies have already mentioned, like where you just feel broken, where you're just like, okay, basic human bodily function is to poop, eat, and make babies, and I potentially may not be able to do one. So I just, right, exactly. Chad got to go. Chad got to go, and he gonna go. But it is one of those things where I'm just like, it's the work that I do that motivates me to keep going, because I'm very well aware that like we may have Big Chad and his brother Josh may show up. But it's motivating, or not motivating, like Shani said, not necessarily empowering people, but equipping them with the skills and the tools to empower themselves. Like I have students who, you know, little babies, they were high schoolers, you know, they don't understand like me having to teach my students why it's not okay for you to ask a woman if she wants kids or if she's going to have kids. And then those kids going on now, like my first class of students are like 24, 25 now. And some of them have like sent me messages like, Miss, I got what you got. I finally got him to do the surgery. I got what you got. And it's things like that.
Thank you. Shani, I see you typing. You want to open it up? Okay, I'll ask the question and then I'll open it up, because I really think it's an important question, and I'm sure some other people have some things that they want to share in reference to this. What advice do you have to gender non-conforming persons who are seeking treatment and are further misunderstood by doctors?
So I was going to tell that person, like, to always push back and tag and support when needed. The same way that if you have the opportunity and means to, if you can get another provider, you can. If not, escalate it up and light shit on fire. Don't let anyone gaslight you. You deserve the same quality of care that anyone else knows. Be well informed and as educated as you can be on the subject matter, which is your body, right? And know what you want when you go in there. And if they don't, again, report to whoever you need to. And like I said, if you need someone else to amplify your voice, don't be afraid to reach out to someone so that they can amplify you. Do a search for gender affirming practices and look up ratings for those practitioners who are well-versed in LGBTQ care, gender non-conforming care, so that you get what you need. And if you feel like you cannot like advocate, or I'm a mild-mannered person, I don't have it in me, tag in one of us, and girl, guy, them, they, I will come for you. I got your back. I don't mind. I'll do it like I'm getting paid for it, and I'll enjoy it, but like in all seriousness, I will, write letters and say, hey, this happened to me. It's lawsuits around that, right? And so this is your life and the balance. And if someone wants to play with your life, you can play with someone's paycheck. They could be homeless tomorrow, it's my myomectomy or your mortgage. Which one are we going to leverage here? Okay. And so it's very important that my care matters, and it's in a manner that's, conducive to me. You're not going to sit up here and just dismiss me because of your biases. And if so, again, that's a real lawsuit. But they have patient advocacy, units in hospitals. Make sure that you utilize those resources, utilize like Health and Her Hue and other, platforms where you can kind of get ratings on doctors and ask like, hey, send me the name of a very like cool gender affirming practice that you have had a good experience with. Granted, everyone's experience may be different, but if everyone says like, hey, this is pretty cool, then then maybe you want to check out that place. Sarah, I got you.
Thank you. Anyone else like to add to that? Because I think that was so helpful. I wanted everybody to hear that. Just first of all, Shani is so funny. She said, "Is my myomectomy or your mortgage?" And she's serious. Put that on Mary Had a Little Lamb. Okay, period. We're not playing. Just ask the question. I think this is a really good question. Any advice or tips regarding public policy? How would one start if we wanted to write bills that support health equity and specifically impact the endometriosis community?
If you want to look into lobbying, look for lobbyist groups, but I will also start on your local level. You can get like proclamations done, things like that. Look at the laws that are already in effect. Learn when they go to the table, and learn what advocacy groups and lobbyist groups are at the table already, so that you can like kind of go and support with them. Learn who's sponsoring what bills. That's very easy. You can look up and see what committees certain representatives sit on, so that you're able to go in and like write your local representative, your local senator, and say, hey, I see that you're up for this bill. This is how I can add support. Reach out to those legislative assistants working on that matter, so that you too can be a part of that. But lobbyist groups are out, and you can just look them up and look up the ones who are doing women's health. We recently got funded for like 26 million, right? The House and the Senate passed us a bill so that they can get more research and funding. Endometriosis is housed under child and like family, like human development. So like NIH, like they always have like grants and research. You can start there and go and look up what's going on over there. They usually have a lot of initiatives on their website that you can look up to.
Thank you for that. I think that was really beneficial. A lot of times we are so focused on, advocacy. We kind of forget that advocacy has to also be backed by bills so that we can see real change in the community. And of course, it's not an easy process. Being an advocate is overwhelming sometimes. Being that person that creates the bill and fighting for the bill and pushing the bill can also be overwhelming. So it's important to make sure that we're looking into the best resources for ourselves as far as like how to do things correctly and go about it the right way so that we're not overwhelming ourselves. So thank you for that answer. We're going to actually slow it down now. I'm just going to ask one last question, and also everybody else that has a question in the Q&A, please send your questions over to the v.dotpod@gmail.com, and we can answer those live tomorrow on our season finale of the VDOT podcast at 3 p.m. Eastern. I want to make sure that we continue to focus on health equity more so than just endometriosis. I understand this is an endometriosis conference, but we do not talk about health equity enough. And I want to make sure that we focus mainly on that. So for the end, how can you tell? Let me get my words together in a nice way. How do you share with allies and people in the community that are not of color? How do they support us in an effective manner? You see, I took my time with that because I don't want to be offensive. How do they support us in an effective manner? What are your suggestions for them to support us when it comes to health equity? And Shannon, you touched on it earlier, but I want us to like end the conversation with this so that it's very, very clear across the board how it is important for people that are not of color to support us when it comes to health equity.
First of all, pay us what we're worth. Stop asking for, can you appear on this? Can you post this? Can you do this? I want to partner. Partnership is it's cool. It's cool in collaboration, and I love collaboration, but it's also cool in coins. And so, like, money gets things done in our communities, right? And so, as we're trying to, expand and we want to do these things, it takes money to make things happen. Sometimes, so if you have access to capital, we would glad if you share it. And now also know your place. Know when to step up and know when to step down. Sometimes allyship means just standing and listening. Sometimes it actually means, saying things. And so I think you have to know your place. Make sure it's not tokenism. Don't only engage me when it's beneficial to you or if it's just for a brand. So not just Black Lives Matter, not Blackout Tuesdays. It should be all year round. It should be continuous. It should be when it makes you feel uncomfortable too. Don't do it. Don't just change your little photo and make it cute because every inconvenient when everyone else is doing it. Stand with me when it matters most, when the ship is sinking. Be by my side and say, yes, this is a hill I'm willing to die on. Yes, I'm diehard supporting this cause, this initiative, this group, right? Reparations basically pay us. A lot of times, these companies will say as an ally, like I'm supporting you in this manner, and it's just temporary and it really doesn't really benefit the movement anyway. It should benefit, us even when it's not beneficial to you kind of type deal. And it's just not like, only done when it's cute and convenient. So know your place and know when to step up and when to stand down. I'm a big ally to the LGBTQ community, right? And so I know that in every space, I just can't go up there and take on their platform and fight their fight for that community. I learned to listen and I learn from that community and I'm teachable, right? I'm moldable. So what can I learn? How can I use this as a teachable moment for me? And I ask, how can I support you guys? What do you want me to do? And I'm okay with the roles that they assign me, right? I can't say that I can't get all the press ops and stuff like that. If it means wiping the floors and cleaning up at one of the events, then that's what it is, because that's what they need them yet. So go where you're needed, not where you're wanted, just because it looks good.
I would also say, check your people. Check your people. I shouldn't have to check your people. You know this. You wanted to be all up in my face talking about some, I hear you, I understand you, I'm like, okay, right. Now go check your people. Go check your people.
I hold them accountable. Accountability is the word of the day.
That is the word of the day. Like you telling me in a closed space, or you even telling me in like an event that you hear me, you see me, you hear this, that, and whatever. Then we leave this event and you still maintaining the status quo. No. Check your people, check yourself, and hold yourself accountable.
April Christina said, don't DM me. They're famous for that, And then it's also recognize that I am a community. I'm just not like this isolated person. So don't continue to use me. If you know that I have a whole tribe behind me, include my tribe. Just single me out and say, I'm supporting the Black community. You're supporting me, okay? And you may support me because I come on your platform and I may be politically correct. No, support my sister too. Grab her as well. She's part of this movement too. And so it's accountability and truly being there for the community and not just people who you like, people who resonate with your brand. If you're going to be with the cause, support the brand, the whole community, not just, isolated people.
Thank you for that. It's so important. This was a much needed discussion. Of course, we did not touch on everything, but it's powerful to have that. We are appreciative, so appreciative. Check your people. I mean, it's so simple. It really is in actuality. Hey girl, hey. It's so simple. And we really just want people to understand that health equity is a thing. This is not something that we made up. You know, this has been happening for years. Now, whether or not we have spoken up about it is totally different, you know, and we can understand that. However, like a lot of times we are faulted because of who we are. You know, I woke up and I was this way. I was born this way. I can't change how I was born, and I would never change how I was born. But me being born this way should not um exclude me or put me in a situation where I can't have access to something, you know, because I am a person of color, because I am a person that, you know, maybe gay or bisexual, or I may be somebody that has a age difference, or there may be different classism. I think that there's so much bias and stereotypical things that go on in the medical industry that just are really shocking, genuinely shocking and disheartening, but not shocking at the same time, if that makes sense. Because it's
I
like,
think because it keeps a lot of them paid, right? So systemic racism is profitable for them. It works for them. It keeps them living a lifestyle that they can, you know, that they afford it, right? And so when we speak up against, when we try to tell them to change the system, they're like, wow, I'm gonna lose our money on this. So they profit off our pain, right? And so keeping us in our place, you know, it's comfortable for them. And so until they acknowledge that and they come to terms with it, then, you know, we're going to see things that we're seeing that we've seen years and years ago. And so again, we are the ones who have to like pick up that torch, that barrier, and just continue to like burn shit down, call out bias, call out racism, call out patriarchy. And, you know, we just can't be silent about it. We can't be silent about it at all.
at all. I totally agree with that. Thank you so much, because at the end of the day, all we have is our voice, and you know, whatever you choose to do with your voice is perfectly fine. But it's very clear that everybody here, everybody during this entire conference is choosing to use their voice for something good, something beneficial, something to raise awareness about endometriosis, about health equity, about all of the things that are going on. And I appreciate you all for being vulnerable and transparent and telling your stories and opening up, because we got to go back to the root of this. We have to be our authentic selves. The whole theme of the conference is for us to be us. The whole theme of the conference, we talk about our table standing on the front lines, Indo-Blacks, advocates and allies conference. We are building our own rules. We are building our own things, and we are literally ourselves. Yeah, you out the hospital?
Right, I was clapping.
I
That's
wanted-
my clap.
I wanted to come on because we were talking about allyship last as I was getting discharged. And something I just wanted to add was today I witnessed it. I feel like I have never, ever had a doctor on my behalf say, I'm not sending her home based on what you think. I'm not going to tell her we're short-staffed. I'm not going to tell her none of that is her problem. And he listened. They tried to send me home 4 times without fixing the problem. And that's why we've been here all day. And it was a white male doctor, my white male nurse sent me here today because I needed that. And they both fought for me until they had to make accommodations and make sure that I got what I needed today. I have hyperemesis gravidarum, another rare thing for us. And because of that, I'm walking out of here with what I need right now. That's one thing I'll say to medical professionals: when you know, and you can do better, just do it on our behalf. You know that if we kick and scream, they're not going to listen and they're going to think that we're being dramatic, but you know. And when you know, say something. Use that privilege. Use whatever you can do in your power as a medical professional. That tenure, that experience, use it on our behalf. And I just experienced true allyship today, and it was just too divine for me to not share with you that I'm walking out right now. So I wanted to share that. This is the least professional I've ever been for a conference, but it's so real. And I'm so appreciative, Lauren, for you keeping me on here and you all being in this with me today.
Thank you. Thank you for sharing that, because that is the definition of true allyship. And that is all we are asking for. That's all we want, is true allyship and health equity and awareness on endometriosis. It really works just like that. As simple as they said, we are not sending you home until she has what she needs. It's very simple. So I want to say thank you so much for sharing that. I'm going to wrap up, y'all. Let me not cry. We are wrapping up day 2. Day 2 of our table, Standing on the Front Lines, Indo-Blacks Advocates and Allies Conference. Y'all, I am super, super excited. I got goosebumps all over. Thank you so much for joining on this second day. We have talked since 11 a.m., but we have all learned something. And that's the major part about it. I just want to say thank you for hanging in there, chilling with us, having a good time, playing some good music and listening and joking and having serious conversation.